Hello, and welcome to One World, One Health, where we chat with people working to solve some of the biggest problems facing our world. I'm Maggie Fox. This podcast is brought to you by the One Health Trust, with bite-sized insights into ways to help address challenges such as infectious diseases, climate change, and pollution. A One Health approach recognizes that we're all connected: animals, plants and people, and the climate and environment. One Health also usually involves science. Science means asking questions and systematically answering them using proven methods. Scientists share information and build on what they've learned, and they agree they must prove their assertions. They can't just make stuff up. The scientific community can and does call out mistakes and fabrications. And yet, we're living through an extraordinary time when people are doing just that in the face of facts. Scientists are under attack, especially in the United States. And now this attack is coming from the very top, from the White House. A vaccine denier, Robert F. Kennedy Jr., has been given the job of running the U.S. Health and Human Services Department, which oversees the single largest funder of biomedical research in the world, the National Institutes of Health. HHS oversees the Centers for Disease Control and Prevention, a world leader in public health. It oversees the Food and Drug Administration, which regulates drugs, vaccines, food safety, and medical devices. One person who's been fighting to prevent the kind of anti-science that is on the rise is Dr. Peter Hotez, Dean for the National School of Tropical Medicine at the Baylor College of Medicine in Houston, Texas. He's invented vaccines, advocated for better treatments for neglected tropical diseases, and worked to control the spread of viruses. And he's written a new book called The Deadly Rise of Anti-Science: A Scientist's Warning. He's joining us on One World, One Health to talk about his book and how to counter this recent rise in hostility to science and public health. Peter, thanks so much for joining us.
Thanks. It's great to see you again, Maggie. We have a lot of history of 20 years of talking to each other about various pandemics and infectious disease outbreaks. It's always good to catch up with you.
We go way back, and you have always helped journalists and the public understand science. And I can't tell you how grateful I am, and I know many people are as well.
Well, you're also one of those individuals who works hard to get it right, and not everyone does that. So it's especially rewarding for me to work with you.
Well, it's all a team effort, right? Science is a team effort, and I think that's one of the things we're going to talk about. It's one of the reasons you know that you can trust it. Gosh, you and I have been through a lot. We've been through anthrax, Ebola, Zika, various flu outbreaks, bird flu coming and going, and there's a measles outbreak going on in Texas right now. Nonetheless, these are tough times to be a scientist, and you personally have spent a huge amount of time fighting misinformation and disinformation. Aren't you getting tired of it?
At times I do. I often say, during the day and when I'm in the mix and, in lab meetings or writing papers and articles and even books and talking to people like you on podcasts like this, I'm all revved up and it's great and I love it. But the frequency and the tone of the politically motivated attacks against me and colleagues is getting much worse. And now in the United States, there is this politically driven movement to portray scientists as cartoon villains or public enemies. And I'm front and center of that. And it's tough and it's a scary place. And it's a bit demoralizing because, as we've always talked about, I always say the United States is a nation built on the strength of our research universities and institutions, right? That gave us the Manhattan Project and victory in the Cold War and winning on HIV, AIDS, and cancer. And to have it all flipped on its side for somebody's political or financial gain is really discouraging.
And there's probably no good reason to speculate about why people are doing it. But do you have some ideas about what people get out of attacking science?
I can at least begin by talking about the vaccine and virology space. It came from two convergent paths. The way I got involved in this is I'm a vaccine scientist. We made a low-cost COVID vaccine reaching 100 million people in India and Indonesia, proving we can bypass the big pharma companies and making vaccines for parasitic diseases, the ones the big pharma companies are not interested in. And that's what I always wanted to do. And I did my MD and PhD in New York City in the 1980s at Cornell and Rockefeller. The unplanned part was having 4 adult kids, including Rachel, who has autism and intellectual disabilities. And if you remember, the original assertion against vaccines from Robert F. Kennedy Jr. and others was that vaccines cause autism. And I had written a book, Vaccines Did Not Cause Rachel's Autism. That wound up making me public enemy number 1 or 2. And then about 10 years ago, the stuff about autism stayed, but it also piled on another aspect that was more around, the health and nutrition industry. So the phony supplements and nutritional supplements, spectacular cures like ivermectin and hydroxychloroquine, and the level of the attacks against me went up again because I was bad for business. I was telling them, no, you don't need these nutritional supplements. You don't need ivermectin and hydroxychloroquine. What you need to do is get vaccinated, whether it's against COVID or childhood immunizations. And then it took a third quantum leap higher when that got adopted by far right of the Republican Party. And that began with this health freedom, medical freedom movement about 10 years ago, especially where I am in Texas. And anti-vaccine groups started getting PAC money, political action committee money. And it was so frustrating because I'd say, look, I don't care about your politics. That's your right as an American citizen, but don't adopt this stuff because it'll be dangerous for your family, for your kids. And that's what accelerated during COVID. And it started at the CPAC Conference of Conservatives in 2021, where the rhetoric was, first they'll vaccinate you, then they'll take away your guns and your Bibles. And they basically called vaccinations instruments of political control. But it got even worse than that because then they falsely discredited the effectiveness and safety of vaccines. They brought on all these anti-vaccine activists, and then the pile-on came from members of the House Freedom Caucus and Fox News and Joe Rogan podcasts, and saying you don't need to get vaccinated, just take your ivermectin and this kind of nonsense. And the consequence was, in my state of Texas, of the 100,000 deaths we had in the state of Texas, almost half were after vaccines became widely available in 2021 because so many Texans refused to take a COVID vaccine. So they were victims of disinformation campaigns. So 40 to 50,000 deaths, Maggie, unnecessary. And unfortunately now that is not stopping. There's no autocorrection after people, even after the revelation of all the deaths. It's spilling over into childhood immunizations along the same partisan divide. And the Gallup poll just did a survey at the end of last year asking the straightforward question to parents, which is more dangerous, vaccines or the diseases they're designed to prevent? And a significant number, very much along the same partisan divide, said the vaccines were more dangerous, which is ridiculous. So it's spilling over to childhood immunizations. And this is why we're in this situation now where you have huge numbers of kids now in my state of Texas and adjoining states not getting their childhood immunizations. And then you start to see breakthrough infections. That's why right now, as we're speaking, Texas is going through horrific measles epidemic. So the official numbers over about 124, 125. And we just had our first measles death from an unvaccinated school-age kid, which is so tragic. But we're still in the early phases of this. I think this is going to continue to accelerate. And just like the unnecessary 40 to 50,000 COVID deaths, we're going to see unnecessary hospitalizations and deaths from measles. So it's so tragic to watch this unfold.
And as you mentioned, people don't always act in their own best interest. With COVID, people failed to get vaccinated and they paid for it with their lives. But when people do actively turn away from good information, whether they are provoked by social media or politicians or troublemakers of other sources, how do you get them to listen?
Well, the part of the problem is access, because they're all watching the same Fox News channels. And it's not that I have anything against Fox News. I was going on Fox News till they stopped inviting me because I wouldn't go along with the hydroxychloroquine nonsense. Then the invitation stopped. They're unfortunately embedded in this bubble. They're on the same social media sites. Always happy to go on CNN and MSNBC or and all the local news shows and, write for whatever newspaper is interested in having me write. And I do that. But I sometimes have this sense of frustration that it's walled off from the people who really need to hear it the most.
And of course, it's also people who aren't even consuming mainstream media that you mentioned, like Fox News. And of course, this is a growing global problem. There's a young person in my family who is interested in science and facts, but also complains that the media doesn't cover X, Y, and Z, complained that there was no media coverage of bird flu. And when I, sort of said, I believe you might be mistaken, there's been a fair amount of coverage. What he meant was he's not seeing it in his own social media feed.
I mean, I'm old enough to remember, it's 6:30 every evening you watched either Walter Cronkite or Huntley and Brinkley, NBC, and it almost didn't matter because you were getting a sort of a unified American version of the news. But it wasn't only that, Maggie. It's once you shut off evening news and had supper or dinner, depending on what you call it, you hung out with your friends. And if you started espousing some conspiratorial nonsense, your buddies would look at you and say, "What the heck are you talking about? Go have another beer." And it would modulate you, right? Or you would moderate you, but you don't have that anymore. Instead, you start going online and you just start getting access only to the crazy stuff without any filter. And so that's clearly a part of it, is the fragmentation of society. But the fact that really does trouble me that scientists are portrayed in this light as doing something nefarious. I do also say it's partly our fault, Maggie, too, that especially in the research universities and the academic health centers, we tend not to do a lot of public outreach or don't encourage it. And so that creates this vacuum that allows the bad actors to come in and weaponize, what we do and portray us as these kind of shadowy figures in white coats plotting all sorts of nefarious things. And that's one of the things that I tell the leaderships of when I give lectures, whether it's medical grand rounds or pediatric grand rounds at academic health centers. I say, the academic health centers are too involved in protecting their brand and not letting the scientists out there to speak. And not everyone wants to do it, but there's a group who does. And by making yourselves invisible, you have actually added to the problem. And we need to turn that around and offer our PhD students, our MD PhD students, our residents, our fellows, our trainees, our assistant professors, how to do public engagement and communication.
And a lot of scientists, you're one of the best examples, but a lot of people do take the time to explain the science to media. A lot of this is no one person's fault. The world is changing. People are consuming information in different ways. But on top of all that, an unprecedented thing is going on. The current U.S. administration is tearing apart biomedical research and science in a way that has never been seen before. Even if you talk about training new scientists to talk to the public, they're not going to get a chance because they've all been fired right into their probationary periods, and funding for academic research is being cut off. This is going to affect the whole world too, right? Because the US is the single largest funder of this kind of work around the world. Is there going to be a way to fix it?
Yeah. And what I say is this is actually not the extraordinary event this is being portrayed at. This is the capstone of a process that's been evolving. I mean, we should never have gotten to the point where Dodge would be allowed to just slash NIH budgets or NSF budgets. There should have been enough ardent support from it in Congress to stand up to it. And hopefully it will get corrected. But one of the things that I'm saying, and I just gave a talk last week at Baylor to the PhD students and MD PhD students, is even if we can fix the indirect cost issue to institutions, there will be significant cuts to government funding for science, especially biomedical science. And don't take the attitude that this is short term, because one of the things I'm hearing from some academic health center leaders is, hey, don't worry, the House and Senate's going to flip in a couple of years and this will all go away. To me, I don't think so. I think this is more enduring. I think we are a different country from the one I grew up in. Think about how you're going to reinvent American science in a positive way. And I think we're going to have to rely a lot more on the private sector, a lot more collaborations with industry, a lot more collaborations with biotech. I think we're going to have to allow both senior scientists and young scientists fluidity to go back and forth between the biotechs and industry and academia. We've got to loosen up some of the constraints that don't make that possible right now, and maybe change PhD education to make it more biotech focused and less on the traditional model of spending 5 to 7 years in a laboratory with one principal investigator and writing a couple of papers. That we need to change that as well.
That raises the other question, though, of, one of the things you get accused of all the time is you made all this money off your vaccines. And the accusations against scientists is that they're getting rich off this stuff. You and I know that is absolutely 100% not true. But if people move back and forth between industry and academic or government medicine, isn't that going to worsen the perception that it's all too tangled up?
Yeah, it might, and the anti-science people will continue to weaponize whatever they can. So it's not a perfect it's not I'm not saying it's a perfect answer, but it may be one opportunity. It's interesting. I mean, daily on Twitter or X, I get an accusation that I'm a shill for pharma and secretly making millions. And my wife Ann says, if only, right? What did I do? I made a low-cost COVID vaccine with no patent that reached 100 million people. I think, and our other vaccines for parasitic diseases, I once tallied it up. I think in my 40 years of developing new vaccines, I've made less than $5,000, from all my vaccines. So and I'm not complaining. It's just that I didn't plan on getting rich and I haven't gotten rich, but I have a wonderful life being a professor and I've been able to support 4 kids and my family. And it's been an incredibly meaningful ride, but I didn't get rich. And we've got to tell that story too.
Can we talk about the measles outbreak in Texas? As we're recording this podcast, and it is a pre-recorded podcast, the first death was reported in that outbreak. What's going on? Is this an isolated community that's affected?
Well, it started in a Mennonite community, and there's nothing really anti-vaccine about the Mennonite community. It's just that it's an insular group, and all it took is a couple of anti-vaccine activists to swoop in and gain access and take advantage of their fact that did not have access to a lot of real information, weaponize it, convince them not to get vaccinated. But the problem is it's not just the Mennonite community, that the whole area of West Texas has some of the lowest vaccination rates in Texas and in the country. And so low vaccination rates are like warm waters of the Caribbean when a hurricane hits in the summer. And as long as there's enough warm water around, the hurricane will continue to accelerate. And that's what the unvaccinated kids are. So this thing is just ripping through. And so many hospitalizations. And with measles occurs in an epidemic form, around 20% of the kids get hospitalized. That's about the numbers we're at right now. And a certain percentage will get measles pneumonia requiring more intensive care, or measles encephalitis, or measles otitis leading to deafness, or measles diarrhea. And eventually we'll start seeing deaths because measles is a killer disease. Measles throughout the 20th century was a single leading killer of children. 2 to 3 million kids died. And now we've brought it down through global vaccinations to around 100,000, still a lot of kids. But it's a fragile ecosystem. And once you stop vaccinating and once community level coverage goes down below 90%, measles can rip through it just like a hurricane in the Caribbean in the summer. And that's what's happened.
And part of that's caused by the measles virus itself. It's extremely infectious.
Yeah, if especially among unvaccinated kids. So if you line up 10 unvaccinated kids and expose them to measles virus, 9 of them will become infected. And one of the reasons is it takes a very low dose of virus to set up infection. So you don't need a big inoculum of virus. Also, this virus can linger in the atmosphere. So if someone has measles, and especially before they got the virus and start feeling very sick, they're releasing virus into the atmosphere. Even if they leave the room, that virus will linger in the atmosphere for a couple of hours. So you can walk into an empty room that has measles virus from someone that was there a couple of hours before and become infected. And so between that and the low dose, that's why measles has one of the highest reproductive numbers of any virus is between 12 and 18. That means a single individual on average will infect 12 to 18 unvaccinated individuals. And that's what we're seeing. And that's why this is going to continue to accelerate. The other thing about measles, that is a very long incubation period. So what we're talking about, the cases now, a bunch of other kids are being infected that we won't realize has measles for almost another 2 weeks. So I think this will be a long-lasting epidemic.
What other research are you working on? You've always got your fingers in lots of different pies.
I've got some new vaccines that we're developing, and I'm very excited by that. And I'm also doing some things around climate health, with the rise of all of these infectious diseases because of climate change and urbanization. We're starting to see a lot of illnesses where I'm in Texas and the Gulf Coast, like dengue and chikungunya and Zika and maybe yellow fever could return. And writing my books and trying to convince myself I'm not too old to learn new things. I'll be 67 this year, and I'm still in the mix, and we'll see how long it can go.
Peter, thank you so much for taking the time.
Maggie, you're as great as always, and thanks for doing what you're doing, and I look forward to speaking with you again.
Listeners, if you enjoyed this podcast, please share it. You can find links to this and other important topics at onehealthtrust.org. And let us know what else you'd like to hear about at OWOH@onehealthtrust.org. Thanks for listening.
Thank you for listening to One World, One Health, brought to you by the One Health Trust. I'm Ramanan Lakshminarayan, founder and president of the One Health Trust. You can subscribe to One World, One Health on Spotify, Apple Podcasts, or wherever you listen to podcasts. Follow us on social media at One Health Trust, one word, for updates on One World, One Health and the latest in research on One Health issues like drug resistance, disease spillovers, and the social determinants of health. Finally, please do consider donating to the One Health Trust to support this podcast and other initiatives and research that help us promote health and well-being worldwide. Until next time.